Please welcome the CEO of the Pangaea Global AIDS Foundation, Mr. Ben Plumley.
Oh, good morning, everyone, and what a real thrill and honor it is to be here. I'm here with friends and family. Many of you will recognize me from 13, I guess, years ago as the founding executive director of what was the Global Business Coalition on AIDS. And it's really great to see so many of the founders still here, from Chevron, which I think had one of the first most comprehensive workplace programs, not just in their industry, but across the whole of the private sector, from Anglo-American, Brian Brink, and there are some conversations I'm sure Brian and I could share with you about Holbrook's first trips to the mines and how he tried to hide behind me when we saw coal actually being pulled out of its seams. And Gary, I'm about your height, so you can picture that. From MTV, Bill Rohde, our first chairman, to Heineken, who pioneered HIV in the brewing industry, from Merck, who was one of our pharmaceutical peers and leaders, to Standard Chartered, which really set the bar in terms of the banking sector's engagement in AIDS. So it's really wonderful that everyone is here and that the GBC is at such a prime and important place and taking on the very important task of helping us all meet the Millennium Development Goals. Now, what you may not know is that I was also the champion of my very first company, what was then Glaxo Wellcome, the champion of its workplace program back in '96. And I think all of us would agree that right back in those days, getting any business action on AIDS was like getting blood out of a stone. But things have changed dramatically. When I moved back to the UN in 2003 after my stint with Holbrook, I was absolutely horrified to discover that most of the UN programs did not provide treatment to HIV positive people. People who had preconditions were not covered for treatment. And so we were in this really interesting situation where the business community had moved ahead of the public health community. And it's that kind of innovation and leadership that I think you all should be so rightly proud of. The engagement of business in setting up workplace programs was really the foundation stone for the GBC. We support workers, our most precious resources. We directly address stigma and discrimination. We drive the provision of quality services. If any of you have seen the kind of hospitals that Chevron and Anglo-American have in Southern Africa, my word, you really should do so. For a Brit like me, brought up in the National Health Service, it's quite a shock to see that quality. And also to drive the quality of new services and care, and I think that's what we're going to honor this morning. So, as I get the right papers in front of me. The commended programs, which we can see here in this category, have helped HIV services for hundreds and thousands of people, employees and their families and community members across Southern Africa. And I really want us to shout out two. The first is for Zimbabwe Platinum Mines for its HIV and AIDS program, and also the Cardno Emerging Markets USA for its health initiatives for the private sector program. So please join me in congratulating them. And now we're going to talk about the winning company. And I'm really thrilled and honored to be able to make this award, not only because this company was indeed one of the very founders of the GBC, but they're also based, like me, in the center of the universe, the Bay Area in California. The company's had a long history of engaging employee involvement in HIV, but when it decided to extend its workplace program to 6,800 worldwide retail employees, it faced new challenges. It's a young, mobile population. a population that is very vulnerable when it comes to HIV and has, generally speaking, lower access to health services. But of course, it's a population that is extremely tech savvy. So the program was designed to take account of all of these particularities into account, resulting in tailored activities such as in-store trainings, interactive quizzes, and videos. The program has so far led to an improvement of at least 15% across all indicators, from general knowledge, critically, to non-discrimination. But the company went a step further. In partnership with Mercer LC, it successfully negotiated the waiving of HIV exclusions with insurers in several of the countries in which it operates. And that's really no mean feat at all. I know that's a challenge that many of the GBC members have. They provided their own coverage when local options were insufficient. And they have made deeply practical, impactful contributions to meeting MDG 6. So, I'm very proud, really honored to announce that the winner of the Workforce Engagement Special Emphasis on HIV, TB, and Malaria category is Levi Strauss Company for its Employee HIV program. So please join me in congratulating them.
We certainly don't hear as much about HIV/AIDS anymore, but HIV/AIDS is not over.
Epidemia HIV/AIDS.
Hindi pa tapos ang laban.
No se ha acabado todavía.
But HIV/AIDS is not over. As a company, our commitment and resolve to ending the spread of HIV/AIDS is important now as it's ever been.
We have a new generation of young people at work, and we need to talk about HIV and AIDS. So I chose to discuss my HIV status and my story with my employees and my colleagues so that they can learn more, because HIV and AIDS is not over yet. And by working together, we can end it.
In South Africa, we have the concept called Ubuntu. We are who we are because of who we are together.
We can't do it alone. We need you.
We hebben jullie nodig. Het begint met jullie.
हमें आपकी ज़रूरत है.
We need you. There are 8 things we need to focus on to manage HIV/AIDS at work.
Work with us, work with each other.
And help us stop HIV/AIDS.
Edenu.
Pracuj z nami.
Работай с нами.
함께해요. 让我们并肩作战.
Work with us.
Great, so please join me in congratulating and welcoming Enrique Atienza, Senior Vice President of Levi's American Retail and Global Strategic Operations and Training.
Congratulations. Thank you so much. Wow. Thank you. Thank you. I'm gonna. It's gonna be hard otherwise. Well, thank you for having me. Good morning, everyone. Very proud and humbled to be here with all of you. I'm just literally an ambassador receiving this honor and this award. I think who probably should be here is the significant amount of people in the HR departments and corporate affairs, and some of our retail employees that have put so much effort behind this program. But I'm actually really glad that I am here representing the business. Because so many times, particularly with companies and in issues like HIV/AIDS, it takes a lot to get the business rallied up behind this idea and this program. And I personally and Levi Strauss as a whole believe that doing profits through principles is always good for the bottom line. And so, really glad to be here. And on behalf of LS&Co, we want to, thank you for this honor. Our company's leadership in HIV/AIDS began actually in 1982. with our employees. 31 years ago, actually, Robert Haas, which you saw on the video, LS&Co former CEO and current board member, and other leaders joined employees to distribute information about HIV/AIDS. Today, our response is really focused on improving access to HIV education, prevention, and care for our employees and also their families worldwide. We ensure that our employees in offices, factories, distribution centers, and retail stores, over 2,800 all over the world, have the information that they need to prevent HIV/AIDS, that are able to get the services that they need, and also have the support that they need not only at work, but also at home. I'm talking specifically about retail. Our retail associates around the world really represent the next generation of our workforce, and hopefully the generation that we need to end HIV/AIDS in our lifetime. And keeping this population engaged, healthy, it is, and in the workforce, it is absolutely critical. So thank you to the HIV education programs. Actually, our retail employees gain confident on being supported at work. I mean, they're confident to be supported at work, increased last year with this program by approximately 40%, which is a significant increase to where we were before. Also, the knowledge of how HIV is transmitted, the confidence of non-discrimination and anti-stigma at work, and the comfort that their HIV status will remain confidential at work. Also, all of it increased last year. Additionally, I'm specifically very proud of this. In the room, you see 2 AIDS memorial quilt panels here in both sides. This one here from 1988, the original one, and then this one here, created by our retail employees last year to commemorate the 30th anniversary of our commitment to fight HIV/AIDS. And basically the way this came up, we have all of our employees worldwide and approximately 4,000 retail employees in the US, Canada, Mexico, and Brazil. We engage them to envision a world without AIDS, and their messages is what you can see in this new AIDS quilt that is here. Very impressive. And we last year, Patrick Holfaster, that you saw on the video here, and other leaders of the organization took the quilt at the opening ceremony of the International AIDS Conference in Washington, D.C. And then after that, we took it to retail tour all over the US, and we have it exposed in the windows of our stores in over a dozen of cities from all over the US. Another example of our commitment to for the business, that instead of having some promotional messages or our product in the windows, we committed to have our support for the eradication of HIV/AIDS in the windows of our store, and continue the dialogue and engagement with our consumers. While we are really glad of the work that we have done, we also know that our work in HIV/AIDS is not done. Our effort to engage critical partners like the insurance industry, our local nonprofit partners working on the front lines to end HIV has helped us provide what is needed for employees, and really opened up the dialogue for others to also improve access to HIV/AIDS. So together, we are really committed to see this issue through. And I just want to say, finally, thank you to GBCHealth for all of the work that they do, and for this honor, our partners that we have learned from and share with, our leaders, and obviously our employees. So let's keep working together, work with us, as you saw in the video, and have a great rest of the conference. Thank you. We need a photograph. Oh, okay. Here we are. One more. Thank you. And let me just say, as well as Enrique, there are colleagues from Levi's here, Pavi and Joanne. Do you want to stand up? I know you've been part of the work, as well as any other Levi's colleagues are here. Obviously, this is a team effort, so congratulations to you all.